Harsh winter weather is taking a toll on much of the country, and now it's having an effect on San Diego, too. Why storms in the east may force more of San Diego County's vaccination sites to close.
Plus, as people with cancer and other high-risk conditions get ready for the COVID vaccine, our in-depth team looks at doctors' recommendations for those undergoing treatment.
The San Diego Zoo is open again with some new additions to show off. In a story that's positively San Diego, zoo staff tell us the changes they saw in animals during lockdown and the lessons they learned from the things that didn't change.
ABC 10 News at 6 starts now.
While San Diego has been spared the crippling winter weather that has hit much of the country, the effects are still being felt here. Good evening. I'm Lindsay Pena in for Kimberly Hunt.
And I'm Steve Atkinson. Because of those storms, San Diego County supervisors said today several shipments of the COVID vaccine that they were expecting this week will not arrive as originally scheduled. Our ABC 10 News reporter Laura Acevedo explains what this means for those with upcoming appointments.
The impact could be felt as early as tomorrow, although county officials did not specify which locations could be affected. The county says they were expecting nearly 53,000 vaccines that haven't come. That number includes part of a Moderna shipment that was delayed last week, forcing the Petco Park vaccine site to close for 3 days. Vaccinations resumed there today. The vaccine manufacturers are currently in the middle of severe winter storms, now creating new delays impacting San Diego County. Moderna's facility is in Michigan and Pfizer's is in Massachusetts. County officials say not only could they have to pause vaccines at certain locations, but say appointments will also likely have to be rescheduled, asking San Diegans for patience as they navigate these delays.
I think folks understand we don't control the weather and we do not control the arrival of vaccines for when they actually get here. And we appreciate everyone's patience. We will continue to monitor the situation. We will adjust. Despite
the setbacks, county officials say they are confident they will be able to start vaccinating people in Tier 1B the first week of March. Laura Acevedo, ABC 10 News.
San Diego's county supervisors also say they will notify people by email if their appointments are canceled. And starting next month, California will offer COVID-19 vaccines to people with high-risk conditions like cancer. But many cancer patients and survivors, they do have questions like, should you delay the vaccine if you're currently undergoing treatment? Our ABC 10 News anchor Derek Stahl is going in depth to sort through the recommendations.
COVID-19 and cancer are a dangerous combination. The risks vary, but a September study found that for every 4 cancer patients who contract the virus, 1 will die, a stunning 25% death rate compared to the 2 to 3% we see in the general population. And that's why it's so important for people with cancer to get vaccinated. But there are caveats. For the 17 million cancer survivors no longer on treatment, it's a slam dunk. Get the shot when it's offered to you. But for patients undergoing treatment, it's more complicated, says Dr. Thomas Buchholz of Scripps MD Anderson Cancer Center.
There are not recommendations specifically from the FDA concerning this.
He says cancers come in many forms, and so do the treatments. Some treatments can affect your immune cells, the same immune cells that vaccines target, particularly chemotherapy.
Because they are killing rapidly dividing cells. Some of the rapidly dividing cells in our body are immune cells. So it's kind of a sledgehammer, depending on the chemotherapy, that not only attacks the cancer, anything that's rapidly growing.
UC San Francisco's Dr. Peter Chinhong says patients on chemotherapy were intentionally left out of the COVID-19 vaccine trials, so the data is limited. But the concern is not about the safety of the vaccines causing extra side effects or affecting the cancer.
We know, importantly, vaccination is safe in cancer patients. It really has to do with how effective the vaccines will be. Are they going to be as effective as in patients who aren't receiving chemotherapy?
Chemo reduces the number of white blood cells, including T cells and B cells that make those precious antibodies. So when you're on chemo, there are fewer immune cells available for the vaccine to train. That means the shot just might not work as well.
The good news is these white blood cell counts recover. They recover quite quickly.
Dr. Buchholz says delaying vaccination by a week or two may be all a patient on chemo needs.
Our recommendation is to carefully follow the white blood cell count and perhaps give vaccination during the course of chemotherapy at a time when our white blood cell counts have recovered from a particular course. And so we could introduce it in the cycles of chemotherapy.
Other specialized treatments might warrant a longer delay, like engineered CAR T cells or a bone marrow transplant. But in most cases, patients on typical regimens of chemo or radiation should get the shot, but they should talk to their doctor about maximizing the timing. Derek Stahl, ABC 10 News.
A new article in the journal Lancet says that cancer patients will likely need repeat vaccinations or booster shots during their lifetime to maintain protection against the virus. But the CDC says at this time, revaccination is not recommended, although the agency notes the guidance could change. Our ABC 10 News in-depth team continues its commitment to tracking down answers and sharing your stories when it comes to the vaccine rollout. Send us an email with your questions to tips@10news.com.
First responders in Chula Vista are helping seniors get the COVID vaccination by bringing it right to them. Our partners at KPBS report it's part of a new program called Operation Immunity. Today, crews with the fire department went to a mobile home park where they say some people were worried about where they would get their shots.
I just appreciate, they come here and help us out, so we don't have to worry about go somewhere.
Today, they were prepared to deliver about 200 shots. The paramedics administer them, and EMTs are currently being trained to help as well. Homebound seniors over 65 in Chula Vista can call the number on your screen, 619-476-2397, to schedule an appointment.
The county's 14-day rolling average for positive COVID tests is still dropping. Today, it's down to 5.5%. There were about 500 new cases reported today. In fact, more than 254,000 San Diegans have had COVID since the pandemic began. The county also said that 57 more people have died from this virus. Nearly 3,100 people in the county have now lost their lives to COVID-19. A group of scientists is urging the Biden administration to update the CDC guidelines on COVID-19. Two of the scholars are from UC San Diego. They say the agency needs to recognize that aerosol particles are the primary source of transmission. The scientists are asking for a clear face covering standard for the public, and they also want N95 masks to be required for all healthcare workers as well as high-risk workers in confined spaces.
Why aren't you using this? Their answer is we are following the CDC guidelines and they are not adequate right now. And so that's not okay. If we really want to end this pandemic, we have to acknowledge that this virus is spreading through the air, or we are just going to keep yo-yoing back and forth.
Right now, the CDC's website says that COVID-19 spreads most commonly during close contact through larger respiratory droplets. It adds the virus can sometimes be spread by airborne transmission.
Another big stimulus package may be on the way for millions of Californians struggling during the pandemic. Governor Newsom announced a new deal with lawmakers today called the Golden State Stimulus. If passed, $2 billion will go to be split into grants for small businesses and nonprofits. Restaurants, bars, hair salons, and cosmetology businesses will be eligible for fee relief. And low-income Californians who get the Earned Income Tax Credit will receive a $600 stimulus check. The state legislature may vote on that deal next week.
All right, I want to go back out to that breaking news we first brought you at 5, that major crash in Chula Vista. This is at the intersection of Palomar Street and Santa Olivia. Here's what we know so far. 3 people were taken to the hospital with major injuries. You can see it's a devastating crash. 2 others were treated right there on scene. The intersection is still closed at this hour, and of course, we will continue to follow this breaking news.
Happening right now, people are gathering for a rally in support of recalling Governor Newsom. This is a live look at that event. It's being held at the Encore Event Center in Kearney Mesa. The groups Reform California and Reopen California organized that rally. Those in support of recall are trying to gather enough signatures by mid-March to force a special recall election.